Are you struggling with the planning phase of the nursing process or care plan? Welcome to the chaos of nursing priorities, where life saving decisions meet 12-hour shifts. Think of that show Survivor, only the hospital edition. Instead of voting people off the island, you're deciding who gets pain meds first and who has to wait. Picture this: you have one patient's appendix is staging a dramatic exit. Another patient is demanding a call to check on their cat, while a third patient insists their toenails are top priority. Meanwhile, your coffee's getting cold, your stethoscope's missing, and the call lights are blaring. What do? You panic? Do you cry? No! You prioritize like a pro, okay? Whether you're a student or a seasoned nurse or anywhere in between, this video will help you master the art of nursing care. We'll cover Maslow's hierarchy of needs, smart outcomes, and how to keep your sanity intact while doing all of this, with a few laughs along the way. So grab your clipboard, channel your I've got this energy, and let's tackle the ultimate challenge of how to decide what matters most when everything feels like an emergency. Let's do this. Now, one thing you gotta understand is that nursing isn't just about following steps. No, boo boo. It's about thinking on your feet, making smart decisions, and keeping your patients at the heart of everything that you do. Now, to nail the planning phase of the nursing process, you'll need top notch critical thinking and clinical reasoning skills. Here's how to make it happen with a dash of flair and a focus on what really matters. Now, first thing, you gotta know the rules. You got to get cozy and comfortable with your facility's policies and standards as well as its procedures. These guidelines will help you set priorities, identify patient outcomes, choose evidence-based interventions, and help you document your care plan. But don't stop there. No. Always remember that your patient is the star of the show. Hello. Their preferences, their needs, and their goals should help guide your every decision. Think of it as creating a personalized health roadmap, one that basically leads to their best possible outcome. Secondly, you need to see the big picture. What's the end game for your patient? Whether it's a smooth discharge, improved health, or better quality of life, keep that ultimate goal in mind. Every intervention you choose should move them closer to that finish line. And don't be afraid to lean on your clinical experience. Just know when to call in reinforcements if situations is beyond your expertise, okay? Because let me tell you, teamwork does make the dream work. You gotta trust your gut. But in addition to that, you gotta back it up too. If you got a hunch about something that your patient needs, great. But before you run away with it, make sure your plan is backed by solid research. Your intuition is a powerful tool, but it works best when it's paired with evidence, okay? Now, we all have biases. You want to make sure you acknowledge yours and keep an open mind. Your patient's unique story should always shape your approach. A, collaborate like a pro. Let me tell you something. Nursing isn't a solo act, so you gotta work hand in hand with your patient and their family to set priorities, identify outcomes, and choose interventions, okay? That's appropriate to their care. If the care plan doesn't align with what the patient values or address their specific needs, it's back to the drawing board again. So you don't want to forget about considering social determinants of health, factors like income, education, and environment. All of that can make or break a patient's progress, so keep those in mind. Goals versus outcomes. What's the difference? Let's clear this up right now. A goal is the destination, for example, reduce pain, while an outcome is the measurable result that shows you've arrived. For example, patient reports pain level of 2 out of 10 within 24 hours of nursing intervention. In nursing, we focus on expected outcomes, which are specific, measurable criteria that help us evaluate whether our plan is working or not. Think of it as setting a GPS route and checking off milestones along the way. In the planning phase, there's formal versus informal planning, and both of them are important. Formal planning is the structured, documented process you're probably familiar with. It's essential for individualized care, setting priorities, and ensuring that everyone on the team is on the same page. However, informal planning is the quick, on the spot decision you make every single day. For example, a surgical nurse may have to reshuffle tasks to address a patient's post op pain. A geriatric nurse may have to spring into action when a patient starts choking. These moments may not be written down, but they're just as important. The key is to balance quick thinking with a coordinated team wide plan. You got to understand there's three main stages of the planning phase of the nursing process. You have in the acute care, you have initial planning, which this starts with the admission assessment. This is where you'll create a comprehensive care plan based on the patient's needs, using standardized plans as a starting point, but tailoring them to fit the individual client. In the ongoing phase of the planning, you have as new data comes in, you tweak the plan to keep it relevant and effective. This might mean refining diagnoses, adjusting outcomes, or adding new interventions. While discharge planning, from day one, you're thinking about how to prepare the patient for life after discharge. This includes teaching, counseling, and connecting them with community resources. Let's consider this real life scenario here, just so you could get a better understanding of the three phases of planning. Let's meet Mr. Johnson, a 65-year-old with a fractured hip, a stubborn streak, and a deep love for hospital pudding. Here's how his nursing care unfolds. In the initial planning, okay, this is where you have the admission drama. Mr. Johnson arrives grumbling about hospital beds and missing his recliner and wondering why it can't be with him. You assess, you create a care plan, and you set the stage, which includes pain meds, fall precautions, and physical therapy being scheduled. Now, the bonus here is where you're going to play his favorite Rolling Stones album to ease his anxiety. The takeaway here is that the pilot episode introduces characters to set the plot. That's what the initial phase does. Then moving towards the ongoing planning phase, this is where the plot thickens. Okay, it's day 3. Mr. Johnson refuses physical therapy because he's not training for the circus, so he says. So now you got to readjust your plan of care, where you adjust your goals, you tweak interventions, and bribe him with puddings, okay? Whatever works. This is where you're going to bring in a peer mentor, maybe. You might make physical therapy less scary and address any concerns and fears that he may have. The takeaway is mid-season twist, you adapt, you engage, and you keep the show rolling. Now, in the third phase, which is the discharge planning, which is the grand finale, here you see Mr. Johnson is pumped up to go home, but he's also nervous about falling. So this is what you're going to do. You're going to teach him about walker safety, schedule follow-ups, and arrange home visits. You're going to throw in some extra pudding cups for that road trip. Takeaway here is that the series finales, you wrap it up, you ensure a happy ending. Moral of the story is nursing care is like a 3-act play where you plan, you adapt, and you finish strong. Now go watch your patient's next chapter. Okay, some of you may be wondering, why does planning matters? This is why. A well-crafted care plan isn't just a to-do list. No, it's like a roadmap to better health. It helps you deliver personalized, effective care, set clear priorities and communicate them to your team, promote continuity and quality of care across the shifts, evaluate your patient's progress and adjust as needed, and it documents your work for legal, research, and reimbursement purposes. Interpersonal skills. Let me tell you something. This is like the secret sauce to the planning phase of nursing process, okay? Your ability to connect with patients and their families is what makes your care plan truly effective, believe it or not. You gotta listen to their hopes, their fears, and their expectations. The more involved they are in the planning process, the more motivated they'll be to achieve their goals. And remember, standardized plans are helpful, but they're just a starting point, okay? Your challenge is to make them uniquely suited to each patient that you're caring for. Hey, let me tell you, thinking critically and acting wisely is very important as you plan care for your clients, okay? And there are certain questions you got to ask yourself. For example, when it comes to setting priorities, you should be asking what needs immediate attention, what's most important to the patient. And when it comes to identifying outcomes or results, you should be asking what changes will show the plan is working and what's the timeline. In regards to choosing the appropriate interventions, questions you should be asking is like, what's most likely to help? How can I tailor it to this patient? And what's the worst case scenario and how can I prevent it? Communicating the plan, certain questions you should be asking is, does it address today's priority? Is it clear to everyone on the team? Setting priorities. This is like the art of nursing triage. Hey, let's face it, nursing is like juggling flaming torches while riding a unicycle. Yes, it is for those of you who don't know. You got a million things to do, but not all of them can be top priority. So, how do you decide what to tackle first? Welcome to the world of prioritization, where we rank nursing diagnosis as high, medium, or low priority. Think of it as a triage system for your to do list. Whether we realize it or not, in healthcare, we sort of use like this priority pyramid. Under the high priority, this would be life-threatening issues that has to be addressed right away. You're thinking, OMG, I gotta call the doctor right now. An example scenario would be a patient's appendix is about to burst, and here you are debating whether to address their pain first. Spoiler, call the doctor right away before that appendix does a dramatic exit. Hello? Then you have the medium priority where the issues is not so life threatening, but it's still important to address, right? So let's say, for example, a patient with a fractured pelvis needs help bathing, but first they want to call home to check on their twins. That's okay. Let them call their twins and then we'll bathe right after, okay? Low priority would be things that can wait. For example, a patient's toenail that needs trimming, but the patient is not currently busy dying. So nail care can wait. Some guides you can use to help you in prioritizing your nursing care includes number one, Maslow's hierarchy of needs. This one you can't play with, okay? Maslow's address the basic needs that needs to come first when you're prioritizing care. For example, you can't expect a patient to enjoy music therapy if they're sitting in wet diapers. Hello, somebody. Yes, even adults have diaper issues, okay? So you address the physiologic needs like food and water, safety, love and belonging so that they have the emotional support needed, self-esteem where they feel good about themselves, and self-actualization where they are achieving their full potential, like finally beating that level of Candy Crush. Another model you can use is the patient's preference. You got to ask certain questions like, what does the patient care about most? If the patient is worried about their kids more than they are about their own pain, then maybe you should help them call home first. Unless, of course, they're actively bleeding out. Then maybe at this point you may want to multitask. You also got to anticipate future problems. Sometimes you may have to be the voice of reason. Let's say you have a patient who has limited mobility, but they refuse to change positions because they just don't want to for whatever reason. You may want to gently insist that they do move and change position because at the end of the day, pressure ulcers don't care about any of the patient's preferences. Hello, somebody. Critical thinking is like the nurse's superpower. Let me tell you, yo, when setting priorities, certain things you should be asking yourself is like, what needs immediate attention? For example, if it involves blood or screaming, okay, it's probably emergent, okay? What's my responsibility and what should I delegate? You're not a one nurse army, so you need to know how to delegate safely and effectively. Can I use a standard plan or do I need to get creative? Sometimes you got to think outside the box safely. What's the relationship between these problems? Because sometimes fixing one issue might solve another issue, okay? Efficiency for the win. Hey! When it comes to writing outcomes are the results you're looking for. You gotta think smart. Smart goals for smarter care. Smarter outcomes are like the GPS directions for patient care. They basically tell you where you're going and how you know when you've arrived. All right, so you got to think specific, measurable, achievable, or attainable, same thing, realistic, and time bound. So a poorly written patient outcome will be patient will feel better. It's too vague. You want to be more specific. So a better written outcome would be within 24 hours of nursing intervention, the patient will drink 2,000 milliliters of fluid and report pain levels below 3 out of 10. Some common mistakes when writing your outcomes. For example, writing interventions as an outcome. Okay, you offer patient water every 2 hours. You can't write the outcome like that. No. Instead, a correctly written outcome in this regard will be the patient will drink 60 milliliters of water every 2 hours. You see it? Very specific, very demure. Another common mistake is using measurable verbs. For example, the patient will understand their medication. No, don't do that. A much better written outcome would be something like the patient will list 3 side effects of their medication. Another mistake that is commonly seen when writing outcomes is being too vague. For example, writing something like the patient will cope better. No, instead you can write something like the patient will identify 2 new coping strategies and demonstrate reduced stress behaviors. Interventions are the actions you take to help patients reach their goals. They can be nurse initiated, which are things you do independently, like teaching or repositioning, giving a back massage, or physician initiated, which are things you do based on a doctor's orders, like administering medications, okay, or inserting a Foley catheter. Collaborative interventions are things you do with other team members, like physical therapy. There are 3 types of outcomes as it relates to the planning phase, right? And you better know these 3, okay? They include cognitive. This is what the patient knows. For example, the patient will list 3 benefits of low sodium diet. There is psychomotor, which is what the patient can do. For example, the patient will demonstrate proper wound care. And then there's affective, which is what the patient values. For example, the patient will express motivation to maintain a healthy lifestyle. One thing you better understand, no 2 patients are the same, so no 2 care plans should be neither. For example, nurse A gives pain medication and calls it a day. Too vague of a care plan. Okay? Nurse B assesses pain, gives medication, and checks in later. A little better, but Nurse C, however, assesses pain, gives the medication, offers a back rub, listens to the patient's concern, and uses positive suggestions to enhance the medication's effect. I hope each and every one of you are like a nurse C. You see how specific and individualized that care plan is? You all better strive to be like a nurse C. You hear me? Common problems in outcome identification includes not involving the patient. You gotta get them involved in the game, okay? Another problem is skipping data collection. Please get into the habit of collecting data first. Okay, that's part of your nursing process. Another problem is using bad data. Bad data equals bad plan. Another problem, vague outcomes. Be specific. Avoid being too general, okay? Another problem, weak diagnosis, because that leads to weak outcomes. So use clear diagnosis where you end up with clear outcomes. Another problem is using unclear orders. So you want to make sure you write it clear so that everyone knows what's going on and what to do. Another problem is orders that don't solve the problems. So you want to make sure the orders that you're going to use is going to fix the issue. And then using outdated care plans. Keep it up to date or else it's just going to be useless. All right? So keep these in check for a solid care plan. So here's the deal. Nurses are basically the unsung heroes keeping the healthcare system from falling apart. Yes, we are that damn good, okay? But guess what? While clinical reasoning and decision-making skills are super important, not enough attention has been given to the actual outcomes of our interventions. Yep, we're talking about making sure that our impact is measurable and tracked. So each standardized language, like the Nursing Intervention Classification or NIC, you want to make sure that you use it and use it well because number one, it shows the world how awesome nurses are in the healthcare system. Yes, and we are all that in a bag of chips. It gives structure to nursing education and practice. It helps pick the right intervention for each patient. It improves communication so that everyone is on the same page, from nurses to doctors and everybody else in between. And it lets researchers track effectiveness and the cost of nursing care. Additionally, it teaches clinical decision making to new nurses. It helps administrative plans for staff and equipment needs, and it improves reimbursement systems for nursing services. Also, it creates nursing information systems that actually work, and it educates the public on the power of nursing. Okay, you got to understand, while standardized language is awesome, remember, patient always comes first. The care plan should always reflect their needs, their priorities, and real problems. After all, if you're truly partnering with your patient and their family, they should read your plan and say, "Yep, you got us." Okay? Listen, outcome identification and planning are where the magic happens in nursing. It's where you take all the data, the insights, and the relationships you've built and turn them into an actionable, patient centered plan. Whether you're jotting down a formal care plan or making a quick mental note, your goal is the same: to help your patients thrive. So think big, stay flexible, and never lose sight of the person at the heart of it all. After all, that's what nursing is all about.